Hi friends, today we're going to talk about how our largest internal organ, the liver, can let us know it's having problems. The liver plays an incredibly important role in the body, and any problems with it can seriously affect our health. Unfortunately, however, the liver doesn't have pain receptors, so most of its problems go away without significant pain. But you should not despair. Today we will tell you about the early signs of liver problems that will help you prevent dangerous consequences. A healthy liver is the basis of a healthy life, so it is very important to identify the primary symptoms of liver diseases and problems in a timely manner. To help you with this, we have prepared a small list of early signs of liver problems to look out for. Skin itching and flaking. The liver, a real laborer in our body, its cells not only filter harmful substances, but also produce bile, a valuable assistant in the digestive process. However, as with any laborer, the liver can have problems. Their manifestations can be very diverse, and one of the most unpleasant symptoms is itching. When there are problems with the liver, itching is not just a cosmetic defect, but a sign that something is wrong in the body. In fact, the bile produced by the liver should flow freely into the intestines to participate in digestive activities. However, if for some reason this flow of bile is blocked, the bile begins to build up in the liver, causing localized itching in various parts of the body, such as the soles of the feet and palms of the hands. This itching can be nightmarish and can intensify, especially at night. This is where a hot shower or bath can help. Warming the skin helps to minimize the itching and soothe it. However, you should not rely on such measures alone. To solve the problem, you need to treat its cause, the accumulation of bile in the tissues of the liver. Therefore, if you suspect liver problems, don't delay and see a doctor. Skin changes. Skin is the mirror of health, and it's true, especially when it comes to liver disease. As you know, the liver plays a key role in many processes related to digestion and metabolism. But what happens to the skin when the liver can't handle the load? The skin can let us know in the language of its manifestations. For example, pitting hemorrhagic rashes and multiple bruises can indicate a blood clotting disorder, which often accompanies liver disease. And yellow plaques on the skin, especially on the hands, elbows and feet, may indicate the presence of excess cholesterol in the body, another symptom associated with liver function. But the most prominent manifestation of liver problems on the skin is palmar erythema. This is a reddening of the skin on the palms of the hands in the area of the thumb and little finger eminence, which can occur symmetrically. When pressure is applied, the skin turns pale, then returns to its previous color. This is due to impaired blood circulation in the skin caused by deficient hepatic function. Thus, the skin is a reliable indicator of liver health and can help to detect problems in the work of this important organ in time. Cracked heels. One of the main tasks of the liver is to produce bile, which plays an important role in our digestion. But what if the liver is not working as intended? The reason could be due to poor diet or even stress. But what happens to the skin when the liver is not doing its job? Not enough bile can result in the body not getting the right substances, including vitamins E, C, A and B3, which are essential for healthy skin and keeping it toned. If the liver is not working well, the skin becomes dry and can lose its natural luster. But don't despair, as nutrition can be our liver and skin's best friend. Remember that it's not only what you eat that matters, but also how you do it. It's best to consume food gradually and not overeat. Include more fresh vegetables, fruits, berries, greens and wholemeal porridge in your diet. Remember that proper nutrition and skin care is the key to healthy and beautiful skin. And your liver will be grateful for your care. Swelling. If the liver is not coping with the production of bile, this can lead to water stagnation and salt buildup in our tissue. As a result, we may experience pitting edema on our legs. This is a clear symptom of problems with our lymphatic system. Hair loss. Poor liver function can not only damage the health inside, but also bring out visible signs such as hair loss. The liver plays an important role in supplying building materials for growing tissues, and if it fails in its function, hair can fall out faster. Increased sweating and increased body temperature. High concentrations of harmful compounds in the liver cells not only make it difficult for the liver to function, but can also lead to unexpected symptoms such as excessive sweating and increased body temperature. Constant feeling of fatigue. Have you ever felt that you wake up tired even after a long sleep, or you feel like you have no energy for simple daily tasks? Slow digestive processes caused by the buildup of toxins in the body can lead to sleep problems. How does it work? When you don't get enough sleep, your body begins to increase production of the hormone cortisol, which affects the process of falling asleep. As a result, nightmares and insomnia become frequent companions in your life. Fever and high temperature is one of the signals to look out for. If you notice an elevated temperature, you should consult a doctor, as it can be a sign of inflammation of the liver, gallbladder, or ducts. Often people who suffer from constant pain in the liver area notice a slight rise in temperature up to 37.8 degrees. With cirrhosis, thermometer readings can reach 38 degrees, and fluctuations are observed throughout the day. Especially with the onset of evening, this symptom accompanies such diseases as acute cholecystitis, longitis, hepatitis, active cirrhosis, liver abscess, and hepatic colic. Don't ignore the rise in temperature, as it could be a signal that your liver needs help. If you experience this symptom, be sure to see your doctor for diagnosis and treatment. Bad breath. If you experience bad breath, you should not panic right away. Your liver may just need some help. When your body is hard at work fighting toxins, the odor can be a real cry for help. But don't worry, the solution to the problem may be easier than you think. Some dietary changes, such as increasing your intake of water and vegetables, as well as cutting down on alcohol and smoking, can help your liver cope with its tasks. Ultimately, proper liver care can not only improve your health, but also freshen your breath. Jaundice. When our liver starts working to the point of exhaustion, it can gradually develop what is known as parenchymatous jaundice. In the beginning, the jaundice may not be obvious, but gradually yellow patches begin to appear on the eyes, on the tongue, and even on the palms of the hands and feet. This can be the result of damage to the liver cells, which cannot remove harmful compounds from the blood as efficiently. However, there is another type of jaundice, mechanical jaundice, which is caused by blockage of the bile ducts and often manifests itself quickly and with severe skin itching. In any case, if you notice a jaundiced tinge in your skin or eyes, be sure to see your doctor for diagnosis and treatment. Abdominal enlargement. Diffuse liver disease can lead to enlargement, and portal hypertension can lead to enlargement of the spleen and liver. While flatulence may seem like just a minor discomfort, it can be caused by digestive difficulties and fluid problems in the abdomen. If you notice changes in your abdomen, don't hesitate to see your doctor. Vascular asterisks and red dots on the body. Healthy skin is something we all want to achieve. But what should you do if vascular webs appear on your body? Our cells can accumulate excess estrogen, which negatively affects the skin's blood vessels. As a consequence, some blood vessels increase in size, creating noticeable vascular stars on the body, including the legs, arms, back and neck. Red dots on the body can be a sign of serious liver problems. Our blood vessels are negatively affected by toxin buildup, resulting in poor circulation to the outer parts of the legs. Skin manifestations can be of different sizes and shapes, but in any case it is a reason to think about the health of the liver. Dyspepsia. When the liver stops functioning properly, it tells us about itself through our stomach and intestines. Dyspeptic symptoms such as belching, nausea, vomiting, diarrhea, constipation, and a feeling of heaviness can be caused by liver dysfunction. But this is actually just the beginning of the problem due to inadequate digestion and absorption of fats. The quality of our stools can also change, and this can be not only unpleasant, but can also indicate serious liver problems. We are finishing today's issue, and you can find many interesting videos on our channel about the benefits and harms of fruits and vegetables, as well as diseases and methods of their treatment. Please don't forget to subscribe to our channel, click on the bell and share this video with your family and friends. Thank you for watching and see you soon on the Healthy Lifestyle channel.